Hi, I'm Dr. Justin Moody, and I'm the founder of Implant Pathway. Our journey to creating Implant Pathway was really going from a love of teaching, but primarily based in private practice, to going to a model of I'm going to teach and mentor doctors as the majority of my practice, and then some little private practice on the side. We started Implant Pathway back in 2015, and we started live implant training here in the greater Phoenix area in 2017. And in October of 2023, we moved into our new facility in conjunction with New Horizons Institute. It's a 501c3 nonprofit that its mission is to take care of the patients of the greater Phoenix area and beyond. And Implant Pathway's mission is to train doctors with live implant training and direct over-the-shoulder mentor supervision. And it's a win-win situation for all. You know, the name Implant Pathway just kind of came about as we discussed. You know, anytime you start a business, you're thinking about, you know, what's your mission statement and what's your goals and what you want to do. And I was always under the impression of being able to, you know, meet all these doctors over the years. Like, everybody kind of takes a different path, you know, to get from point A to point B, you know, like, and some people's path is doing a little bit of implants back in their private practice to, you know, that's all they want to do in their practice. And some take a year to get through the material. Some people take a few months to get through the material. So all I really knew was implants, so we knew we wanted that in the name. And pathway is like, hey, like, it's your implant pathway, you know, how you're going to get there. I think what makes Implant Pathway different than any of the other CE courses in implant dentistry in the US is that it's the live patient education. And, you know, you don't get that everywhere. It's one thing to learn the didactic portion of it from a book, online modules, even sitting in a class and doing hands-on exercises on models. It's another thing to work on a real human, you know, where they bleed and you have to get them numb and put sutures in. And we do that with a one-to-one mentor-student ratio. So, like, you're never out on an island. You're never, like, you know, waiting for someone to come into your room to check or ask, you know, for you to ask questions. So really the difference maker for us is that we have live mentor-based patient education. Our group of mentors is second to none to any in the world. And, you know, it goes to those core principles of, you know, how you would, you know, what mentors fit this environment. But really what makes it so unique is that their willingness to give of themselves and to not only support the doctors while they're in the course and doing the procedures, but our mentorship goes long beyond it. Like, our mentors, you know, the attendees that are with them, they have their Instagram handles, they have their cell phone numbers, they have their emails, and the mentors, they reply, they look out after them, they follow up with them, and that is like, you know, and they become friends, they become colleagues, but like it's really the special thing, and it's what holds us together. You know, when I first started it, you know, I reached out, you know, the original groupers that they call themselves the OG, you know, but the original group of mentors, you know, were personal friends of mine that I'd gone through these CE events with, and you know, I knew their skill levels firsthand, and they wanted to teach and give back. The the mentor pool now has grown tremendously, you know, because as we grow the programs, we need more mentors, we do more courses. But what is really, I think, the most satisfying career wise is that we've now had doctors that have gone through the program that meet the criteria for being a mentor and now start coming as a mentor. And I think it's super powerful for the doctors attend a course to hear from a mentor that sat in that chair 2 or 3 years prior and now is over here doing it. Because I think it gives the attendees confidence in what they're learning, you know, is quality. And it also gives them goals, because I think that I think it satisfies a really human desire to help others, and not just the patients, but like to help other dentists be like the best version of themselves, and to be able to do things that they may only have thought were possible. Because really, as humans, like you're your only self limiter. If there's something that you want to go do, like if you want to go do it, you can truly go do it. It doesn't matter what it doesn't matter, what it is. And I think that's a big part of what's made this mentor group family, and has been around for all these years. As a teacher and a mentor, when we my job is, and what I love is getting people excited into implant dentistry, and getting them off the sidelines and into the game and doing implant dentistry. And I think it's really valuable that we get some reps and get some consistency and some wins in doing implant dentistry. Everyone takes a different path, hence the name, and that is, some people will stay in their lane and do singles and easier cases, and supplement their regular dentistry with some implant dentistry. Some people will find that surgery really drives them, and that's their desire to do more of those procedures. Those doctors will seek out more complex cases and more complex courses. And for me, I'm just really really blessed to have a group of mentors that are of such a high skill set that want to come back and now teach some of the courses. And the mentors have a hierarchy as well. Some of them we call clinical instructors, which means they teach the course and mentor the course. And then there's mentors that just come and do the courses. But everyone's got their own skill sets, and we tailor that to the complex courses. And I think that as you move into that world of more complex cases, it requires more in depth in the knowledge, and it also it actually makes the live surgical component of what we do even that much more important, because having a much higher skilled mentor or someone that does these cases, and then being able to do them on a live patient before you go back to your practice. I'm all about having a foundation, a knowledge base, and having the reps in these more complex cases. And then these are the docs that they've been to multiple courses. They kind of know the pathway way. And then the mentors in them by now are probably tightly aligned and friends. And we've got this online study club platform where you're starting to see people post those cases and get like real-time feedback. And man, like that to me is the path to the more difficult cases.